Okay, hello everyone, and I am yet again here with another topper of the INISS, and I'm very happy to do this interview yet again. Meet Dr. Yamini Rana. She has secured AML rank 1. So many congratulations, Dr. Yamini. How are you feeling?
Thank you, ma'am. Ma'am, I'm feeling elated, relieved, and most importantly, I'm feeling surprised.
Really? Oh,
Yes,
but I'm sure it's the most pleasant surprise you've ever had.
definitely, ma'am, definitely.
Okay, so for everyone, Dr. Yamini Rana has done her MBBS and MS both from GSVM Kanpur, and she is a fresh pass out. She completed her MS just 2 months back. So,
Yes,
yet again, we are here to believe that we are made to believe that being a fresher is not an impediment to cracking the INISS, right?
definitely.
So we'll just chat along with Dr. Yamini, where she will tell us a little bit about her preparation journey, what went around in her mind while she was preparing, and whether it was the first choice or not, and of course about the second stage preparation also. Okay, so Dr. Yamini, can you tell us a little bit about yourself and how did you start preparing for INISS?
Ma'am, our MS examinations were in January, and after that, we got our results came out in around 2 months back. That is in March, and our NEET
Okay.
SS was on March 31st.
Right.
So because we didn't have much time, so I wasn't really preparing. I just gave NEET SS. I didn't really prepare.
Right.
And but post NEET SS, that's when I started watching your videos and Rohan sir's part for general surgery and your videos for plastic part. And I was always sure about my branch. There was never a time when I had a second thought. I always wanted to do plastic and reconstructive. And so I was sure about the branch, and I already had Maru back. I also studied Maru for my MS professional examinations. Also, I completely studied Maru only. So
Mhm.
post need, I started watching your videos, and so I barely had like 2 months for
So
because
did you
I
get a rank in NEET SS also?
yes, ma'am, I got a rank of 900, which is a mediocre rank, and I was
Mm.
allotted BHU. In from NEET SS, I was allotted BHU. But
Right.
and the round one was when INISS was to take place on Saturday, and at the same time, NEET SS round one joining was happening. So I was like, because I didn't prepare for NEET SS, so I was like, I can do better. I must give a shot at INI. And so, and after NEET SS, that is after March, that is April, until May 24th, I watched your videos. Like
Okay.
nothing else, only your videos and Rohan sir's video, a bit of Rohan sir's video because that I had already watched for my MS exams.
Mm.
So I studied, ma'am. You have explained it so simply and beautifully. And although I was not able to complete the entire part, but I watched around 60 to 70. All the important topics I had covered from your videos.
Okay,
And
okay.
my concepts became very clear because you have definitely simplified everything. And so, but the part that was remaining, which I was not able to watch, for that, what I did was I covered it from the QBank. QBank, I almost completed
Mm.
like
Right,
90%. Only one or two
right.
modules have been left.
Yeah,
So, what
even the Q Bank, we've made a great effort to put it together. So I'm sure
everything.
that must have helped a lot. So did you also subscribe to Marrow for your NEET SS?
Ma'am, I have Marrow since I subscribed to Marrow in my second year.
Oh, okay. All right.
But I was not able due to hectic
Of
duties and
course,
everything. I was
PTs
not
and
able.
all.
Yes.
Yeah. So final year of residency, thesis completion, and all that would be going on, and then exam preparation. Okay. No,
So
but I think you must be a very motivated person to keep at it, and it seems that it was very clear in your mind that this is your path and this has to be it. So no, there's no surprise that you got such a good rank. And so when did you actually start preparing?
in post NEET SS, that is in April.
No, but
Immediately
NEET
after
SS also you gave with some preparation, right? I mean, I'm asking about.
my MS, for my MS professional examinations, which were in
Hmm.
January, I studied Marrow. After that, I didn't really study for that
Okay.
month because not much time was left between that. So I did not really study, I would say.
So
So I
when
just,
you were answering NEET SS, how much of plastic surgery did you read before that?
ma'am, very less, almost nil.
Less.
Not
Okay.
much. Post NEET SS, I was like, my NEET SS did not go well. So I
Hmm.
was like, although I got a rank, but I thought I could have done a lot better. So after
Better.
that, I started I started watching your videos, and I have almost like 60-70% videos I have completed, like end to end I have completed your videos. And I was not able to revise. I only revised like important topics only. From your high yield part I revised important,
Right.
because as it is time was less, so I didn't have that much time to revise,
That
because
much
as
time.
it is some part was, so, and the remaining part I completed from the QBank. That I had almost done 100%. QBank was almost
Okay.
done.
Okay, so that's a very good insight for the people who want to prepare, because see, even in a short duration of time, if you're very focused, and because a lot of it is general surgery also,
Yes, ma'am.
so obviously that takes away that burden, because you're fresh pass out, you've already done that, you don't need to go back to that part at least, and then you can focus on the plastic surgery bit. For the people who appear a year later or something, then I think the general surgery needs to be worked on, because they're more focused on the specialty. So I
Even
think
I
both
was,
have their advantage. Yeah,
ma'am, I had watched your videos earlier, and I had seen all the toppers saying that they have read grabs twice or thrice, and I was a bit scared, like after watching the videos, that I have not, because I didn't have much time, like
yeah,
barely 5 months what I had for the preparation part, along with
right.
my duties also. So I had joined as an SR temporarily in my college only.
Hmm.
So, and also my NEET counseling was happening simultaneously. So I was a bit skeptical, but I just said, it has to be given a shot, because this is my dream brand, so why not? So I thought,
Yeah.
let's go for it. And definitely, ma'am, your videos, I would say, people ask me that you must have done something else, but no, that's it. Maru, your videos. Apart from that, no time. Even time was not there. Even if I wanted to, I couldn't.
Yeah.
So your
Yeah,
videos were
2 months
completely.
is kind of less for the diverse topic that we cover. But I think, in my videos also, I've tried to keep the base as all the standard books. So, I mean, you can do it either way around. You can read the textbook or come to my videos. You can watch my videos and then go back to books. I think,
In stage one, the MCQ based part, general surgery part, I was able to do almost 100%, I would say.
hmm. So
But
that also played a very important part, right?
definitely,
So that is
definitely, that has
definitely like,
covered me for the loss which I have. But even in plastic part, some questions were there which I didn't know at all. But the rest, you had, most of it was covered from your videos. I don't feel I was lagging behind. If you leave like 4 or 5 questions, apart from that, even as a fresher who didn't have much time, in
hmm,
1.5 months, I have watched all your videos, and although I didn't revise, but still, because you have like even implants part, there was a question on implant, and I could remember you like explaining. You have explained it beautifully in the entire breast part, the implants and everything. So I guess, I mean, I didn't feel like anything was left behind except 4 or 5 questions, which everybody, I mean, nobody can solve 100%, right?
yeah, no,
So,
yeah. I mean, yeah, 100%. I mean, that's it's kind of like reaching infinity. You will never be able to get there. So, and what about so once you did the first stage, when you cleared the first stage, so how did you prepare for the second stage, and what were the questions asked? How many stations were there?
ma'am, stage one results came out like 10 to 12 days after. And the first list that came out was that people who have provisionally qualified. So
Hmm.
27 seats are there, and 21 had qualified. So it was clear
Yeah,
that
I did the Zoom session. I don't know if you could attend the Zoom session or
I
not.
have attended. You asked that question. I only wrote that
Ah,
21.
okay, okay. Yes, yeah. So that's what, like, you only wrote that 27
Yes,
people have
I had
qualified and 21 seats are there. So practically everybody will get a seat. It's
practically
just a
everybody.
matter of who gets what.
Yes, yes,
Yeah.
definitely. So it was clear that everybody is gonna be there for interview. So I was clear. So I called few of my seniors. I saw your videos on YouTube, and I kind of because you can't read everything in, because my interview was almost 7 days after the list came out. So
Right.
lot of time was left. So what I did was I called up a few seniors who are there already, and I watched a lot of your videos on YouTube. So I kind of understood that what all is asked. So kind of I revised how much, although I was not able to revise much, but as much as I could, I did in those 7 days. And ma'am, on the day of the interview, firstly, a day prior to the interview, at around like 2 p.m., I got a mail from AIMS saying that we have to prepare a CV.
Hmm.
So with all our achievements, publications, awards, thesis, and all of that. So I prepared it and I mailed it to them. So on the day of the interview, there were 4 stations overall, ma'am, and it was a
Okay.
tedious, exhausting interview, because it started like at my time, which was allotted to me, was 9:50 a.m. and it went around till 4 p.m.
Oh,
Because
wow. Really?
Yes, ma'am. I was because I didn't sleep. I couldn't sleep well because I was like I have to wake up early and all, and so
Yeah.
there were a lot of gaps because my first station and second station were like 2.5 hours apart. So I didn't know that it's gonna be like so far apart.
No, so I mean, you went to the first station, you completed your first station, and then you were waiting, or
And plus, they don't tell you that you have to wait for 2 hours. They will just say that it's going to be there. So you keep anticipating that anybody could appear anytime.
when
So
is it?
they don't tell you how much you have to wait. So we
Right.
are in that room called waiting room. We have to wait. So
But typically, one station lasted how much time?
10 to 15 minutes.
Okay, so that means altogether just about an hour, but it took about from
But it was like it was
10 a.m. to 4 p.m.
definitely, I was
Oh, okay,
exhausted
okay.
by the end of it. So, ma'am, my first station was suddenly sir appeared and he had prepared an OSCE based PPT. So it was all about instruments. So I
Okay.
was asked about the skin graft harvesting knives. There was Boolean knife, there was Humvee, there was Silver's knife, and then I was asked about mouth gags. Dingman was also there. I remember different dermatomes. He was asking me,
Mm.
and he was asking some related question to it, like how much thickness you can take and all of
Mm.
those things.
Mm.
One question. It was a fast station, and
Okay.
mainly it was a spotter kind of. He was then
Right.
there was an you had to like rapid fire. So
Mm.
he asked me around 10 questions, instruments, and I was able to answer nine. One I couldn't, and there were some maxillofacial instruments
Which
also.
one you couldn't answer?
Ma'am, that I don't know because I had never seen
Okay,
it.
okay, it's okay. Okay, all
So
right.
out of 10, 9 I was able to answer. There was
Right.
nose dissection, forceps was there, Julius forceps was there, and different dermatomes were there, different skin
Mm.
harvesting rifles. All of them
Okay,
I
so
was able to answer.
basically only instruments and then related questions they were
Yeah.
asking.
And
All
out of that, only one was there which I was not
one
able to.
instrument. Okay, okay, okay.
And so that was my first station. Then, ma'am, second station, which was like approximately 2 hours after, was with HOD sir, Dr. Manish Shingle sir. So Manish sir, basically, he started off with like personality questions, like why do you want to become a plastic surgeon? What are your research interests? And like introduce yourself and about my interests and about my hobbies. And then he went on to my thesis, and he asked me the topic of my thesis. Then he asked me about my publication, and then he went a bit into stats. So he
Okay.
asked about who my guide is and what are my findings, some research questions. It was, and then he was reading my CV simultaneously. So he had my CV on one system, and then he was simultaneously asking. So I think what worked in my favor in that station was I have like won a decent number of prizes and awards during the course of my MS. So few of which I have won in aims only at JLN
Okay.
Auditorium. Like
All
there was a national postgraduate quiz, and
right.
my research paper was selected and all of that. So, sir,
Hmm.
he was asking at
That's
Silsicon, which takes place in AIMS New Delhi. So I had
hmm.
won like quite a number of prizes there. So I think it kind of worked in my favor in that station.
Hmm. Hmm.
And he then asked me about my publications, my marks in post graduation, and all of that. So ma'am, I have secured the highest marks in my MS. So he was asking about that also, and some like but just basic questions about you. No academic questions he asked. Some
Right.
research definitely he asked about my thesis and thesis related questions and publication. Nothing
Hmm.
related to plastic surgery. He asked.
Okay.
It
Hmm.
lasted for around 15 minutes.
Okay.
Basically, he's just trying to see what kind of a personality you are and how.
Personality, yeah, yeah, of course. And because in all these institutes, of course, you have to be very research driven. You have to be interested in research because the kind of thesis and all that they do. Also, they are definitely seeking more than what what theory So yeah, so perhaps yeah, this station really would have worked for you then. So
Then
what
his
about the third one? And what's your
his
thesis topic, by the way? What was your thesis?
my thesis topic is safety and efficacy of adipose tissue derived stromal vascular fraction in management of diabetes. So basically, we are extracting, yes, we are doing lipoaspiration, and
Hmm.
thereby we are extracting adipose tissue, and then we are processing it multiple times to extract the stem cells, you can say, in a way, and then we are injecting them, and we are seeing the follow
So
up.
you were
Like,
using some special kind of kit or something for the
yes, yes,
SPF?
but it's a patented technology, Australian patented technology. We have an ultrasound cavitator and we have sonotropes. So we multiple times we process it to have the stromal vascular fraction, which comes tri-layered, and then we discard all the layers and use the one which has the most concentrated stromal.
Because tomorrow I'm going to do a case of SVF injection for face and hair
Yes,
rejuvenation.
it has multiple applications. Definitely, it's
Yeah,
a
so it's almost like it's a semi plastic surgery kind of a topic. Yeah, so
it
you
is
already know lipoaspiration and all.
yes, ma'am. I
You-
I know. I even he asked me like, what all have you seen? So I told him, so this is my I have seen lipoaspiration multiple times, and so his personality is also like a bit overwhelming. So he's trying to. I think he is looking out for your confidence, for your personality, your aptitude, and all of that. And
Mhm.
that was my second station, ma'am. And then the third station was also like 1.5 hours later.
Oh.
And ma'am was there. Shivangi Saha ma'am is there.
Mm,
She
mm,
took my third station, and she first of all she asked about my publications, my findings, and she asked a bit of biostats. It started off like that. After
mm,
and few research questions, biostats she asked. After that, she had prepared an OSCE based PPT also, and then there was few clinical vignettes. Like there were around three clinical vignettes were there. So first one was there was a child. I think it was hemangioma, and then she went first you have to diagnose, and then she will ask you about your approach, then she will ask you about
Yeah,
management.
typical case kind of an approach, case
Yeah,
presentation
like how will
approach.
you approach this patient? She was
Yeah.
not basically looking for, and she was looking for your approach
Hmm.
kind of thing, like how will you
Yeah.
manage this patient, then what all, like that. So it was clinical vignettes, and one of them was on burns, and so that was my third station with ma'am.
Hmm.
And
So
then
on burns, what did they ask?
there was postponed contracture. She was asking about the releases, what kind of
Hmm.
flaps,
Graph.
grafts, management, and all related to burns.
Hmm.
And one was there was a child with hemangioma,
Hmm.
and there was one more which I cannot remember. There were three.
Okay, never mind. All right.
Yeah.
And
Then
what about the fourth station?
yeah. Then fourth. Then there was a lunch break for 15 minutes.
Oh,
Then
thank
after
God.
that, after
You
a
had
very long
something.
yeah,
Yeah.
I had, and then after a very long time came the last station, and there was sir was asking. He had also like first of all he asked me, what is your exposure? When did you pass your MS? And what all have you seen? And then
Hmm.
post that he had also prepared a PPT. So in that he was asking me. One of them was on Marjolin ulcer.
Hmm.
It was a spotter kind of question. Then he went along, what will you do, and then how will you manage the donor, how will you manage the after excising, how will you manage the site, and what all.
Hmm.
Then mainly it was about lower extremity reconstruction. He was asking all the
Okay.
flaps that he can use and
All right.
everything. Yeah, and then he also asked me instruments. He
Okay.
was asking me about all the mouth retractors, mouth gags, and
Hmm.
the RAE tube he was asking, and all the
Hmm.
maxillofacial instruments he asked. Then he
Hmm.
went on to microsurgery, microvascular surgery.
Hmm.
He asked me a bit of questions about that. Then there was an image of vascular clamps or bridge clamps that we use, and he was asking me about the dermatomes also. Images were there, a lot of images. He asked me like
So
there were like at least 10
mostly, I think
images.
this time they were spotter kind of questions, and then
Yes,
they carried out from
OSCE
there.
based, everything
Okay,
was key.
okay.
Clinical
This
vignettes,
was,
OSCE.
yeah. Similarly, I think couple of years back they were doing this during COVID times, like around 2021, perhaps 22. But yeah, okay. So you really had an interesting OSCE. So
Yes.
and I think because you were so well prepared, perhaps you were able to answer most of it, right?
Yeah, some were there which I wasn't,
That's
but yeah,
okay. See, that will always be there. Yeah, that will always be there. I mean, we can expect our efforts to be 100%. Maybe we are not answering 100% of questions, but that shows through whether, or you don't know. So if you are just, as I said, that, if you try to kind of just beat around the bush, it puts them off. So
yes.
it's better to say that, okay, I don't know this, and then go on to the next
Yeah,
question.
ma'am. Like one question was there which I had never seen it. So I just told sir, I have never seen this. I won't be able to.
Yeah,
So
yeah,
I was very clear if I knew this or not. And then,
yeah. So that's very good.
but I
So
think,
great. Hmm.
but I would say like not many people tell us that we have to focus on our publications also for all this. And I should, every postgraduate I think should go in quizzes, should participate in research papers. And this does matter.
Hmm.
It does matter in interviews, and people do really ask about all these things, and they play a very important role also.
Yeah.
Apart from OSCE, you have to answer OSCE.
Yeah, so this is the recent trend that they have been seeing, especially earlier also in PGI interviews when there were separate exams and all, they used to ask. So yeah, and of course the recent trend is towards more research paper, and they hold a lot of value. So
Yes,
yes, while in your MS, I think apart from the regular cases that you're doing as a resident, academics are also very, very important,
yes, ma'am,
and they
definitely.
will continue being important if you are wanting to be in an institute, like a central institute. Definitely these publications would be very important. So from here, now, when do you join? What is the joining date?
Ma'am, nothing has come yet of counseling. First, I will go and cancel my admission from NEET SS, and then I will be doing I9 counseling.
Right. Great. So a lot of relief for you, and so I'm sure that you will now have a relaxed time. Enjoy your time before the full grind of residency begins. So I would ask you, Yamini, give me 5 takeaways from this whole experience that you had, so that it will help the future aspirants how they should plan as freshers. Since you're a fresher, I will ask you about that, but also in general, what should be the general approach, because you've also cleared NEET SS,
Yes.
although you say that your rank was moderate, but that's fine. Since you've cleared both the exams, I think you would be a good person at this point to give me 5 pointers for the future aspirants.
Ma'am, first I would say that believe in yourself that it is possible. A lot of people think that no, we won't be able to like clear the interview and all of that. First of all, it is possible. I mean, you can be from a state college, not from a central institute, and still you can do it because I have done it, so I can say it is possible. Just come along. And secondly, I would say QBank is important. I think it is important to get in the zone. And Marrow's plastic, I have not solved other, but general I have solved in plastic. I would say plastic QBank, a lot of consolidated tables are given, consolidated information is given, and it's very useful. The lip defects part and everything, it is so, the tables are given, they're so easy. Like even if you don't have to time to watch the videos, you can go and check. And thirdly, I would say at the last moment, it is important to revise the like 6, 7 main. We all know that there are few topics that are
Yeah.
like most important topics in plastic surgery, and revision should. Although I was not, I mean, I will contradict here. I was not able to, but I wish I had more time. Then I would have definitely gone for revision, and
Hmm.
it's very important to revise also. Fourth, I would say it's very important to like sleep well and be in a very calm and relaxed mode before the exam, and especially interview because it's a very long haul. I did not know that it's like 6, 7 hours you have to wait, so you have to be well fed, you have to be well slept.
Hmm.
uh, that I would say. And the fifth I would say is that we should, like everybody should must focus on their publications, their thesis, and you should be very well versed with your thesis, with your stats, with your significant findings, because they are asking all of. I was asked all of that, those questions. And which journal are you choosing to publish your paper, and what awards or what activities have you participated during your post graduation days, what all quizzes or research papers or posters, whatever it is. These are also important things. And also I think they give you exposure and confidence also. Like if you
Yeah.
go and present your paper in an institute like AIMS or whichever, it gives you confidence, it tells you a lot about yourself, and then you can improve. And plus I think it gives a lot of confidence to face further interviews and stuff like that. So it's important to participate in activities also, not just keep studying. So yeah, those would be my 5 takeaways.
Great, very
Plus
good
watch your
takeaways,
videos.
I think. Sorry, again.
Ma'am, plus the last one would be to watch your videos. I mean, I'm a whole Marrow person. Like I have my MS all examinations also. I have given through Marrow only. So whatever marks I have, I would credit it to Marrow only. And Rohan sir, the entire general surgery was covered by Rohan sir's notes only. And the plastic part, no other. I have not opened anything else. Although I did attend webinars of different institutions, but my main my notes and everything was from Marrow only. Even my professional examinations, even when I was had to give my seminars during my, we used to have a lot of journal clubs and seminars. For that also, my sole source was Marrow only. I used to open Marrow and study like at night before from all of those.
So great. It's been very nice chatting up with you, Yamini. Where do you belong to? Which
I'm from
state? And
Dehradun.
Dehradun?
Yes, ma'am.
Okay, wonderful. So great. I think you should enjoy your time off now and before the grind begins. And many, many congratulations again. I think very good takeaways you've given, a very balanced takeaway. I think that is a very important thing, because, sometimes in that pursuit of super specialty entrances, we forget what we are doing in MS, and we don't pay so much importance to it because we are doing that with the sole intent of going into a super specialty. So I think that approach is also not right, because we have to enjoy the journey while we are undertaking it. So that's not only the destination, but how you reach that destination is also important.
Journey is very
So wonderful. I'm hopeful of meeting you very soon sometime,
same
and
here.
we'll be in touch. So thank you again for your time in the interview. And I must say that yes, Maro team has worked very, very hard to put it up all together for the students and the aspirants. And I also get to hear this a lot when I attend the conferences, since there are so many students now who've taken the INI, who've taken the Maro SS course. So they always come and tell me that they continued referring to the videos,
Even
even
after
in
getting
their
MCH.
MCH
I'm also
also.
planning to do this. I will now buy my Grabs and Smith, and I will also. I have because I was not expecting, so I had already renewed my plan. So for this
Right.
year, I have, and I will definitely. I know I will be going back to it for your videos and your notes. Now the remaining part which was left, I'll be covering now for my visit.
So yeah, so I'm sure that and once we meet, we can chat more about it. But yeah, I think that the Maro team deserves all the applaud for putting it up so well together, and managing our time out of practice also so well. Because as we are already busy in our practice, it becomes very difficult to kind of find time. But they're always available, always. They try to adjust according to our schedule. So that is a very, very
The
positive
interface
thing about the team arrow.
interface is very user friendly, and the app is very superior compared to rest of the.
Yeah, yeah,
Definitely.
totally. I agree with you on that. Absolutely. So great. Thank you, Yamini, and many, many congratulations. Hope to see
Thank you.
you soon. Thank
Thank you.
you. Bye bye.
Bye, ma'am.